Welcome. In this video, we're diving into a common yet often overlooked condition, cerumen impaction, more commonly known as earwax blockage. We'll explore what causes it, how it affects your hearing, and what you can do about it. So, what leads to earwax blockage? Our ears naturally produce cerumen, or earwax, to protect the ear canal from dust, bacteria, and other foreign particles. The problem arises when this wax builds up faster than it can be naturally expelled. Common causes include using cotton swabs, which push the wax further in, narrow or unusually shaped ear canals, overproduction of earwax, and even the use of hearing aids or earplugs, which can obstruct the natural wax expulsion process. Let's understand what happens inside the ear when cerumen impacts. Normally, earwax migrates outwards from the eardrum to the ear canal opening, where it dries and flakes off. However, when this migration is disrupted, whether by obstruction or overproduction, the wax accumulates. This accumulation hardens and compacts, blocking the ear canal and preventing sound waves from reaching the eardrum effectively. This is what causes the symptoms we'll discuss. Earwax impaction is a very common condition, affecting people of all ages, but it's particularly prevalent in older adults, likely due to age, related changes in earwax consistency and ear canal shape, and those who use hearing aids. Studies suggest that a significant percentage of the population experiences earwax blockage at some point in their lives. While not life-threatening, it can significantly impact quality of life. The symptoms of earwax blockage can vary in severity. Common signs include a feeling of fullness or pressure in the ear, earache, tinnitus or ringing in the ear, dizziness, and a noticeable decrease in hearing. In some cases, the blockage can even lead to coughing due to the vagus nerve stimulation, which passes through the ear. If you experience any of these symptoms, it's important to consult a healthcare professional. Diagnosing cerumen impaction is typically straightforward. A doctor will use an otoscope, a specialized instrument with a light and magnifying lens, to visually examine the ear canal and eardrum. This allows them to directly observe the presence and extent of the earwax blockage. In some cases, an audiometry test might be performed to assess the degree of hearing loss. While we don't typically classify cerumen impaction into distinct types, it's useful to think about the consistency of the wax. It can be soft and moist, or dry and hard. This consistency can influence the treatment approach. Severely impacted or hardened wax may require more aggressive removal techniques. Treatment for earwax blockage aims to safely remove the accumulated cerumen. Common methods include using over-the-counter earwax softening drops, irrigation with warm water, often done by a healthcare professional, and manual removal using specialized instruments like a curette under direct visualization. It's crucial to avoid using cotton swabs or other objects to try and remove the wax yourself, as this can worsen the impaction and potentially damage the ear canal or eardrum. If symptoms persist, you should consult a healthcare professional. Prevention is key to avoiding recurring earwax impaction. Avoid using cotton swabs or other objects to clean your ears. If you are prone to earwax buildup, consider using earwax softening drops periodically as directed by your doctor. If you use hearing aids, follow your audiologist's instructions for cleaning and maintenance to prevent wax accumulation. The prognosis for cerumen impaction is generally excellent. With proper diagnosis and treatment, hearing is typically restored to normal. Recent research has focused on developing new and improved methods for earwax removal, including the use of microsuction and advanced irrigation techniques. Always seek professional advice if you suspect earwax blockage to ensure safe and effective treatment.